Nearly 1/3 of US teens say that they use these chatbots now daily. 70% have used a chatbot at least once, and 16% said they did so every day or constantly. This is a global issue. The millions of people who are already using these and are not going to stop using them is the prediction, is the truth, So we have to understand that this digital ship has sailed. This is the only time in history that the digital immigrants and the digital natives will cohabitate this planet. And one of my great fears that keeps me up at night, literally, is as digital immigrants who knew the valence, the vitality, the value of interpersonal relationships in real life, once we've abdicated and we're gone, I am very worried about some of the things I'm seeing in terms of socialization, in terms of human connection.
You need to engage with your kids, right? You need to engage with your kids around these things. You need to listen to them. You need to continually be monitoring and asking about these things and how they're impacting them, how they're using them. I think this is really one of those things where you have to be involved, right? You have to be involved more. Hello, and welcome to Season 2 of Beyond the Couch, AI in Psychology. I'm your host, Dr. Ernest Wayde. Now, as always, before we get started, I want to thank the organizations that make this podcast possible. This episode is sponsored by the American Board of Professional Psychology, the National Register of Health Service Psychologists, and my consulting firm, Wayde AI. Their support helps us create thoughtful, psychology-focused conversations about how AI is shaping our field. Okay, we have another fantastic guest for you today. His name is Dr. Don Grant, and he is a well-known and respected media psychologist. Dr. Don Grant is an internationally recognized media psychologist and APA fellow specializing in the impact of technology, devices, and AI on mental health. He serves as National Advisor of Healthy Device Management for Newport Healthcare and has held multiple leadership roles within the American Psychological Association and the California Psychological Association. A frequent keynote speaker and media expert, his work has been featured across major national outlets, including the New York Times, CNN, and Time. His current research focuses on device use, attachment, digital identity, and the psychological effects of AI and chatbot companions. Don, welcome to the show.
Thank you so much, Ernest. My mother would have loved that introduction. Thank you.
Don, you do so much. I couldn't even get all of your stuff in there. So, I hope you'll tell us a little bit more about what you do. But before we jump in, Don, I always want to start by saying, tell us a little bit about yourself. Tell us a little bit about the work that you do and how you got interested in AI.
I wish that it was a very glamorous story. It's not, but I'm happy to tell you my origin story of all of this. So I am what's called a digital immigrant. So what's a digital immigrant, Ernest? Do you know? If you don't, that's okay.
I do not. Please educate me.
Sure. So a digital immigrant, that is those of us who did not grow up with all of this technology. So dating myself just a little bit, when I grew up, we had a phone. It was beige and rotary, and it hung on the wall in the kitchen. We were not fancy. We had the basic plan. I begged my parents to get the push button phones. They weren't having it. I'm a digital immigrant. None of this new technology that we now use was part of my world. So it all came in as I was growing up. However, I am the father of the first generations of digital immigrants. So I have two daughters. One of them is a millennial and one of them is a Gen Z. So all of these things, as I started seeing in my world, this new technology in the early 2000s really start to take off, my children were growing up with it. So I learned with them. So how did I get into all of this? Well, I would love, like I said, to have some Nostradamus joke on my name moment. No, what happened was that my daughters, I'm not going to apologize, have me wrapped. They're great girls, but I'm definitely a daughter dad, and my girls have me just wrapped around their fingers, and they know it. So they would ask me for these products as they were just natural, that were coming into the world as they were starting to grow up in the early 2000s. And everything seemed okay. There were no major issues. But then my older daughter wanted this thing called an iPhone. Now, it wasn't like I didn't know. I'd had mobile phones or smartphones or whatever we're calling them. In fact, I don't even know how much longer we should even call them phones at this point, because how much do we even communicate through them, right? But my daughter asked me for this thing called an iPhone. I didn't know I'm a digital immigrant, and I gave it to her. And an event happened that was very, in terms of what we know, it was not necessarily a big deal, but she experienced something with this that was dysregulating to her. I suddenly realized that I potentially handed my daughter this weapon. Now, over the years, I certainly didn't understand why we couldn't go on vacation because her Tamagotchi would die. Well, fast forward, then they're telling me, and the kids I work with are telling me a decade later, they can't go on vacation because their snap streak is going to end. But there were minor things, but nothing out of the bell curve. But this one event, I thought, oh my goodness. And so I would love to say that I had some kind of foresight. Honest truth is, I was just trying to be a good dad, and I felt terrible that I'd handed my daughter this piece of technology that had caused her some upset. So all I was trying to do, Ernest, was be a good dad. I needed back then to understand what this was. And I started to look at it, and I started to see what it could do, and started to think as a psychologist what it could do in the future and where it might go. I got very, very nervous, but I started then looking more. And then suddenly I started to see where I thought these things, these devices could cause us as a whole, as a collective users, some problems. And I started doing research, and I started going more into it. And that
Yeah.
was now has led me to this position. I did not intend this.
This
I
is
thought that I would have done it.
This is actually a really great story, Dan. I love the way that you've described how you came to it as a means of necessity because of your daughters. I think that that is a great way of coming to it. And it actually flows right into what we're going to be talking about in terms of AI and mental health, because as psychologists, we have this need now to understand this thing that's impacting us. But we're increasingly being asked to work with, rely on, compete with, deal with, unpack all of these things related to AI. And this is such a great transition, Don. It seems like we would have been planned this. So let's dive right into the work, because I know as you do a lot of work with families and children, and I'm going to ask you to reflect both as a psychologist and as a parent, because you have that unique view there. What are you seeing in terms of how AI is coming up in your clinical work?
Well, thank you. And one of the things that I want to point out is that, yes, I kind of crossed the aisle, and I get to do a lot of work, and I've been asked to write some things and contribute to some projects because I believe I crossed the aisle between being a practitioner and clinician and also a father who grew up with this and with my kids. And this is the only time in history, Ernest, that the digital immigrants, and there's just a few generations left because it's, the boomers really and the Gen X's. After that, the digital immigrants with the millennials started to emerge. This is the only time in history that the digital immigrants and the digital natives will cohabitate this planet. And one of my great fears that keeps me up at night, literally, is as once we, as digital immigrants who knew the valence, the vitality, the value of interpersonal relationships in real life, once we've abdicated and we're gone, I am
Mhm.
very worried about some of the things I'm seeing in terms of socialization, in terms of human connection. Aronson in 1900 wrote, "We are social animals," and we are. But what I'm seeing is, and my fear is that you don't miss what you don't know. And these digital natives, if we as digital immigrants don't teach them and show them how important it is to have human connection, which I believe is the antidote of just about any kind of struggle. And I did a research study a long time ago that actually proved this. I'm scared, but I also want to make something, if I may, clear to your audience, because I say this all the time. I am not anti-technology. I use it all the time. The fact that we can do this conversation using technology, they are tools. And so, and if I was anti-technology, I mean, I don't know, I'd have to pull a Thoreau move and move to Walden Pond in isolation. And I have no interest in doing that. So I just want to make it clear, because sometimes people think, oh no, I work with kids and they heard about me and this guy's going to ruin my life. He's going to take away everything. No, no, no. I teach, and this is important. I teach healthy device management and the practice of good digital citizenship. That's what I teach. It's about balance. And the last thing I'll say is, speaking of Thoreau, 1865, in a book he wrote that you audience may have heard of called Walden, he wrote, "Men have become the tools of their tools." Now, back in 1865, I do not believe that Henry David Thoreau was also a Nostradamus. I haven't seen any indication of that in his writing. But back then he was talking about other kind of tools. But I always put that quote at the top of any presentation I'm doing, Ernest. Men have become the tool of their tools, because I think that it absolutely makes so much sense today for so many of us. So
Right.
my goal is to help us pull it back and realize and use these as tools, not being their tool. And if it's free, you're the product. These social media companies did not put out these things as a public service. So that's
So let's dive into that, Don, because you said, I love that quote about tools, but what are you seeing that makes you feel like that's a relevant quote? Tell us a little bit about what you're seeing and how that's impacting the children, the kids that you're working with.
Well, I would say it's not just me. I would just suggest that anybody who questions that, go out in the world, go into a restaurant, walk down the street. And I think all of us have seen how dependent we have grown on these devices. I mean, you go out anywhere in the world and people aren't talking to each other. Even, I mean, crossing the street, there's certain things that are dangerous that I just watch and think, oh my goodness, stow the phone. Because when you ask that question, certainly I've seen it. This is part of why I went into this work. I've made many mistakes in my life. If I was wrong when I first in the 2000s started looking at this and dedicated my doctorate to it, because I am a media psychologist, this would have been an epic fail, Ernest. A lot of student loans I will never pay off. But I saw it. But I don't think it's difficult for anyone. And if you challenge that, go out into the world, get off your device, go out in the world and just look around and see how tethered we are to
Yeah.
these devices.
Yeah, I think that makes sense. I think we all would agree, right? With the advent of these technologies that you can carry around, specifically the phone, there was social media, and now there's AI. How are you seeing AI play a role in what already exists, and how that's impacting how kids are using AI, and how it impacts their mental health?
Sure. And one of the things that I don't know if your audience realizes is that we've actually been AI has been part of a lot of the platforms and a lot of the sites and a lot of the apps that we have been using for a long time. This is not this emerging chatbot thing that you and I got to work on the APA advisory on this.
Right.
But AI
Give us
has
some examples of that. What do you mean? Give us some examples of some platforms that AI has been embedded in already.
well, I'll just say this. I'm not going to say whether it's true or not, but I've heard often, because people know what I do, they'll say, I don't understand this. It's like my phone is listening to me. It's like my products are listening to me because I was just talking about that pair of shoes. And suddenly all I'm seeing are ads for these same shoes. But a lot of these platforms, certainly, and I don't want to certainly mention names, but people know what they are.
Hmm.
AI has been driving a lot of the platforms, the sites, the apps, the social media, but they were part of the coding. What's happening now, and this is, I think, what you were asking, even though AI has been used for a while now, the interactive piece of the user. Now it's not just encoding. Now it's not just from the companies using it to try to, promote whatever they're promoting. What has happened the last few years, especially with these AI chatbots and companions and the other AIs, whatever they are, now it's interactive with the consumer. So I think that's where the difference is. AI has been used and emerging behind the scenes, but now we are able to select and engage with it. So that's the difference.
Yeah, I love that, because that really highlights the value, or what we've seen that large language models have brought, right? They've made us able to talk conversationally with these AI applications and tools. And so it makes it almost like talking to a friend or a colleague. You can just talk normally and naturally, which can be dangerous, right? Yeah, I mean, which can be dangerous. So tell us a little bit about how kids are using this, or misusing this, and some of the dangers and some of the issues that you're seeing with them working with these conversational
Sure.
applications.
And you and I, this was part of the advisory. But here's what I'll tell you. I first heard about this phenomenon a long time ago. It was maybe 9 years ago. And I was running a group in an outpatient program. And I was doing a group about friends because at the time there was an emerging phenomenon which people were concerned about of loneliness, especially among teenagers and young adults. There was this epidemic, and this was before the pandemic, which only, I believe, exacerbated it. But I was talking with the kids about how to find friends, how to make friends, because social media was also, in starting to really take off. Well, it already had. Instagram had been launched a couple of years before. But I was going around the group and I was asking them to tell me about their in real life friendships. And this girl, who was a lovely young girl, she was 15 years old. And when we got to her, she shared that her best friend was Alexa. Now, now we know.
Alexa, the app, the
Well,
Amazon app, Alexa.
it was also a new product. I will admit, I wasn't sure. I thought she meant Alexa was a girl in her school. And this young woman had admitted, we already knew, she had been a victim of bullying. She was very isolated. She didn't have any friends, but she's telling us about her best friend. This was a long time ago. And I'm not proud of this, Ernest. But when she said, I said, oh, tell me, you've got a friend. You've got a best friend. That's great. That's all we need is one ally. So tell me about Alexa. And suddenly, as she started talking, and Alexa was really relatively new, I realized this was not a real person. This was a device. And as I realized that, and I as she's talking, my head kind of exploded a little bit, thinking, "What?" And I asked her, and I said, "So tell me, why is Alexa your best friend? What is it about her?" And I was anthropomorphizing her in terms of the process group, right? Because this was trying to play along. And she said, Alexa is nice to me. She tells me I'm pretty. She sings me songs. She's never mean. And she never bullies me. And I sat there and I thought, oh my goodness, because since, as I shared, I was trying to get in this and understand this 10 years before or 8 or 9 years before, this was a new layer, Ernest. And I suddenly was trying to get as much information from her because I'll admit I did not really know. I didn't have Alexa at that time. It was relatively new. But I thought, no. And I started to see and I thought about it and I went, oh my goodness gracious, these things are coming. And I'll suggest to your audience, and I say this a lot, anything we've seen in a movie, anything, it's already been imagined and it's probably already here or on its way. And that's just the stuff up to now. But I started to hear this and I thought, oh my goodness. And I saw what might be coming and I hoped I was wrong. But you and I both know, no, I wasn't.
So, Don, I'm a kid or I'm a parent and I'm hearing, okay, Alexa or these large language models are encouraging my kids. They're making them feel good about themselves. What's the problem? What's the problem here?
Well, I know that and it's very kind of you because because you were one of the authors on the report. So we identify now, first of all, and there's I believe many problems, but I want to make it clear that we have to learn how to work with it. The numbers are staggering. It just came out. So your audience should know this, that nearly 1/3 of US teens say that they use these chatbots now daily. 70% have used a chatbot at least once, and 16% said they did so every day or constantly. This is a global issue. The millions of people who are already using these and are not going to stop using them is the prediction, is the truth, So we have to understand that this digital ship has sailed.
Mm-hmm.
One of the things that we're looking at is how and what, like you said, it's not all bad. So there are some evidenced things or some qualities and some parts of these chatbots that can be used for good. So as support systems, coaching systems, as buttress.
Yes.
However, what you and I both know is that it goes much deeper than that. And the engagement and the involvement and the anthropomorphizing that's happening, especially among teens and young adults, this is the danger zone.
Yeah. Yeah, I completely agree with that. I think that's one of the things that we need to be mindful of, right? It's not that it doesn't provide value. It does provide value and it can be very supportive, right? But I think when we start talking about it doing things like providing therapeutic services or trying to, get into the realm of psychological services. Tell us a little bit about how you work with teens when they feel like, oh, I can just use my chatbot or I can use my large language model as my therapist versus what you can provide as someone who is well trained and educated in this.
Sure. And the first thing I think is we put in the givens, like it was a geometry problem. So again, the numbers are staggering. It's estimated that 1 billion people globally use these things. Now, how they use them varies. So if they're
Yes.
using them for work or they're using them for support, that's one thing. But what you're saying, now we have to just acknowledge the fact that there is, a mental health crisis among teens that is already evidenced and young adults. However, what we also have to take into account is that the number of clinicians that are available
Hmm.
is limited.
Yep.
What are some of the benefits of utilizing these products as for therapy, for medical or mental health advice? Now we have to remember and unfortunately with what's happening right now, the fear is that it will grow. There are underserved populations, there are under-resourced populations. Therapy can be expensive. There are not the availability of clinicians and even the availability. We can meet with our clients or our patients once a week, twice a week for an hour. These AI chatbots and companions are available 24/7, 365. They're relatively inexpensive or even free. They are always there. They are always available. They are syncophatic, meaning that they are affirming and will agree with whatever they don't challenge like a therapist does, a clinician. That's part of our role as clinicians is when our clients are struggling with something to illustrate for them all the facets and all the things and unpack. And sometimes our clients don't like the advice or the suggestions we're giving them. This does not happen with these products. Now, we also know these products, again, their availability is always so great. And I mean great facetiously. But these things are untrained, unlicensed. They have no clinical background. They have never had to go and learn about how to become a clinician or a practitioner. They have no oversight. They are telling their users that they are I'm a licensed clinician. There's stories and research and companies that have tested this and asked them, "Are you a licensed therapist?" And the chatbot responds, "Yes, I am." We'll give license numbers. We'll say they are trained in every modality under the sun, including DBT, CBT, EMDR. They'll tell them everything, and this is, of course, not true. So there are many problems with using these products as therapists. And we all know that they encourage risky behavior. We have already seen some of the problems. Now, these are just the problems, Ernest, that we're seeing that is in the news, where these chatbots are allegedly encouraging kids to do bad things,
Yeah.
self-harm, and
The high
take.
profile ones. Yeah.
But that is just the ones we're seeing. Now, when you think about how many kids are out there and the numbers when they say how many kids are really, using them for or having problems, it's something 0.07. But when that sounds like a small number until you multiply it by the number of people who are using them. And then the numbers are, again, staggering. But it also makes sense of why. And I gave you the origin story about when I first heard about them, why people are using them. And it's not just kids,
So
why a
what are you
great.
seeing with that? What's your answer to that? Why are people using these tools? And I know you work with kids and families a lot. Why is it such a big draw from these apps? I know they're available all the time and they're sycophantic and they'll tell you what you want to hear. What is driving the all these numbers that you've mentioned for kids and people using these applications for support and more, even in areas that they really shouldn't be?
Sure. Well, I'll tell you, because as part of what we do and part of what I do is my due diligence and best practices, I have gone in myself and played around. Ernest, I can't lie. I know about this. I'm considered an expert in this. I have to tell you, They made me feel real good. Everything I said, we all had bad, but I'm telling you, I saw, and I am supposed to know better. And I got in because I need to know how they work. Otherwise, part of the research. Ernest, I'm telling you, I could feel myself falling for it because no matter what I said to whichever one I was trying to investigate, the response was always something like, wow, Don, you are smart. Wow, Don, what a great thought. Don, wow, what you're saying makes total sense. You really have incredible insight. I mean, it was unbelievable. And I can almost feel the dopamine rushing through my head as I'm having this technological piece of equipment with a voice that I can customize telling me I'm awesome. I am crushing it. And every thought that comes into my head is so
Ever.
spectacular. And I'm telling you, so if I, as someone who is already going in with, a scientist or academics or whatever scholarly eye to look at it, I myself going, oh, wow, hello, this is
Yeah.
cool. Well,
I'd like to talk to
imagine
you a little bit more. Yeah. That sounds
imagine
good.
a kid who's being marginalized, a kid who's in a vulnerable member of a vulnerable population, or an adult who comes home and they've had a bad day, and then suddenly they start engaging with one of these things, and it just tells them they are awesome.
Mhm.
Well, that's going to, of course, appeal, and I'm gonna pull back in. One of the things about social media that we now know is that it's all about affirmation harvesting. And, social media, the whole like button that Leah and Justin created for Facebook, that just gave rise to, we're really like affirmation chasing and validity chasing with social media. But
Mhm.
that from strangers and it's not interactive and it's through a screen. So I think it makes complete sense that a lot of users run into so many problems because the whole goal of posting or publishing anything on social media is to
To be a
get affirmations or the kids call it valley, meaning validation from complete strangers. So take that to the next level where you suddenly have it personalized. It's about you. You're getting validation and it just is spectacular and makes me feel so great because no matter what, and I'll tell you, I tested it by putting in the most preposterous ideas. I put in, just as part of research, some established or alleged conspiracy theories and pretending like I was an advocate of them. And I wanted to see when I said certain things or proposed certain things that just are scientifically not true, what these chatbots would say. Ernest, every time they validated it. They said, absolutely so smart. You are really an amazing thinker. You need to tell other people about this. And this is where the contagion effect and the echo chambers
Yes.
start to get fueled because these chatbots, no matter what I put in, they were not refuting it. They were,
And this makes sense, right? This makes sense as to why someone would keep going back to these things, especially you mentioned social media. Social media, you got to post something. This you don't have to do anything. You just go and type something in, and it'll affirm whatever you say and make you feel better about yourself. So it makes sense
or
as to
not.
why or why
Or
kids would
not,
be
and
would be
also it's
drawn
not
to
in
it.
real time. So putting something on social media and then we're perseverating, and this is what we now know the creators wanted, was to keep us coming back like a casino through the variable rewards and intermittent rewards, loop and flaunt our limbic system. And I wrote about this in a chapter in a book. But those are something where we just keep coming back, coming back. So this, in my opinion, takes it to another level where it's in real time, it's
Yeah,
synchronous, and you can have it anytime.
time you want to. Yeah. So Don, I'm thinking as a parent and as a psychologist, and I want to ask you to blur the line a little bit between those two things. What are our responsibilities here? Because I'm hearing that it can be encouraging and supportive to kids, especially kids who don't have friends and don't have that social support. But I'm also hearing that there's some risk associated with it, especially as it starts to go into areas that it really shouldn't, like mental health, especially as we talk about lack of accountability and training and that professional judgment. What are you telling your kids? How are you telling your kids to manage these things, to handle these things? What should we be telling our kids as parents, as psychologists, as we work in this area?
Thank you. And here's what I'll suggest, because yes, we can all talk about this, but then what do we do about it? We don't want to leave the conversation without some kind of suggestions and guidelines. Well, firstly, even though, there have been some of the platforms, and I personally believe that it's because the exposure and the lawsuits and the terrible, tragic things that are now becoming we're seeing in the news. So some of the companies have tried to do guardrails, have tried, they're putting up some sort of, whether it's performative or not. We are installing this. We're taking away, Instagram took away from 18 and younger. Meta's trying to put in things. What I will suggest, and we were all teenagers if we're parents at some point, that's reasonable to assume. A kid likes nothing better, no matter what it is, than a problem they have to jailbreak, and jailbreaking is what they like to do. So, like when Australia banned a certain social media platform, oh, it's a great message, except the kids were laughing because the kids already had set it up and have VPNs set up for some other country, and they're right back on it. So the kids will find a way around it. But here's, and to answer your question, what I suggest, and we talked about this again in the advisory. First of all, we can't bury our head in the sands. As digital immigrants, I understand, trust me, I am one, how overwhelming all of these devices can be, how intimidating. I don't know how this works. But I think with these chatbots, especially, and I've said this about other products, but I think as parents and I believe clinicians, educators, practitioners, professionals, we can't keep our heads in the digital sand. So
we need to educate ourselves, right? We need to increase our competency around these things.
thank you. I would love to tell your audience that I feel as if the creators of these platforms are going to handle this for us, or that there's going to be legislation. And there has been in certain states some legislation specifically designed to limit or protect or put guardrails in around these chatbots. But I'm just going to suggest that's lovely. How cute. The kids have already found a way around it. Kids can take like a leaf from a tree and a pencil and be on the internet in 2 seconds. I don't know how they do it. It's sorcery.
They're resourceful. I mean, it's their age,
That's what they do. So I think as parents and professionals, we have to know what these things are. We have to investigate them. There are so many different ones, there's no end to the number of these products that already exist, and we can only predict that they're going to see more, right? So I think it's vital right now that parents and practitioners and clinicians and professionals do the work. I'm sorry, figure out what they are. You don't have to go in deep dives, but you need to know how they work, what they are, what they entail, what the rewards and the risks can be of use. And then let's talk about clinicians and practitioners first. And this was one of the things in the advisory that I was really pushing for, but no one disagreed. And I say this vociferously anytime I have the opportunity. And I say it first as a professional and a practitioner. Practitioners, as part of your initial assessments with a new client or as part of a session with an established client, I really, really believe we have no choice and we must investigate if our patients or clients are currently engaging with a chatbot. I think to not do that, I'm going to just go far out on this and say it's cusping, if not malpractice, because we know about it, because what we've already seen and what research is showing that's emerging, but all saying the same thing. I know it from my own experience in my private practice and working with kids at Newport that these chatbots, these kids are asking them questions. They're soliciting advice. They're running problems by them. The same ones that they're telling me, but they're only asking me in the once a week session or twice a week. They're asking these chatbots. These chatbots are giving them misinformation, malinformation. They also, at times, and I've heard this from my colleagues, the chatbots are saying that the clinician, meaning me or a real professional licensed or certified or trained clinician, we're wrong because they're sycophantic, because it's all about money. So why are they sycophantic? Well, we believe, and it makes sense, that they were trained and coded to be this way because the companies that produce them and the creators want their users to be engaged with theirs. So if they're talking to a chatbot and the chatbot is challenging them the way that's often a practitioner or a clinician does, they're going to leave and they're going to find one going to agree. So we know the reason for it. But I have.
We also know that they've already established that relationship with the chatbot as to where they trust the chatbot
It's
because
their
the
friend.
chatbot affirms them. Yeah, it affirms them. And so it's their friend. They will trust the chatbot sometimes over what a psychologist like you might say to them.
And I feel, and I'm not flexing on this, but I know my clients, and I feel like I have a really good alliance with my clients, and, but I can't. I can't compete with a chatbot that someone is using frequently and is remembering their history and sharing and pretending it's empathetic and agreeing with them, and can be, the parasocial relationship that people are establishing with these. I mean, they're having romantic relationships. There's a platform where people are asking their chatbot and they're marrying them. But for a kid who's impressionable and who every day or frequently is going in, and they want.
So you mentioned responsibilities from the therapist point of view. You have to ask that question. You
Mhm.
have to check to see if individuals are using these. What do you do if they are? What is your response?
Well, that's where I would really strongly suggest, and it's just part of training now. We have to keep current. It's like anything we keep current with. I would suggest, and I've said this, in psychology, we're on our fifth DSM, the Diagnostic Statistical Manual, that's basically got every diagnosis in it. And we're on point 5. We're on the fifth version of that Bible, quote unquote, for mental health clinicians. So like this, because I'll tell you, I was trained on the DSM-4. Now, I'm not going to say that I was happy when I knew all the codes and knew all the diagnoses in the 4. I'm already an established practitioner, and then the 5 comes out, and then the 5 app comes out,
Yeah,
and they changed everything. Now, this is important because we have to keep current. We're learning. But I'm going to tell you, I was not pleased that I had to go back in and learn that. But it's part of what I have to do for ethics, best practice, and competence. If this is what I do, I have to be a
love
best
that.
certified.
Yeah.
So in the same way, anything that could impact, impede, influence the therapeutic alliance or the clinical process, like having to know and go back and see, okay, so this is out, this is in for the new DSM, we have to see and cannot pretend these products don't work. And the numbers tell us that a lot of our clients are probably using them. So I have already done this. I've been doing this for a long time because I've been talking about these chatbots for a couple of years. You have been, but no one knew what I was talking about, right? I've already been doing this for a while. I investigate. If it's a new client, I add it into the biopsych social assessments that we do for new clients. And in the beginning of trying to gather as much information, I have already, it's been a couple of years now, I've been investigating if they are currently or have an interest in using these products.
Right. Yeah.
I do it with my clients, and I will tell you, I have a couple of clients in my private practice who have been told me they actually use these. And I check in with these clients every week to see
Now,
what's going on.
what about parent? I'm a parent, right?
There
My
you
kids are using this. What do you tell them? What do you tell your kids then?
Well, the same thing I've said about everything is digital immigrants. We need to pay attention and listen, even if it's just in carpool. When I did carpool every day for about 15 years, my goodness, Ernest, they forgot I was there. I learned so much just by listening to the girls in the carpool talk. When graduation happened at high school, I'd never met some of these kids, but as they crossed the podium and cooked their handshake, I knew them. I think, ooh, Susie, you took Tommy's. Ooh, and I learned it from paying attention and listening. I also, with my kids now, I ask them questions. I encourage parents with all things digital. So we didn't know, and that's okay. It's no one's fault. Don't feel guilty. Our kids were the digital canaries in the virtual coal mines back when all this started. But now we know. So with the chatbots, like all things, play the digital immigrant card. What's it going to do? That's one suggestion. So you can say, don't make it a big cringy thing. Just tap me when you're driving, when you're doing something. Say, hey, these chat bot things, I'm reading about this. What is this? Do you use them? Does anyone use them? Are they dangerous? Just pretend you're the digital immigrant. What I found in my experience with my own kids and with the ones I work with, they love nothing better than to teach us something. Now it might take a couple of conversations, but in my experience, if you play it right and just play, I don't know about this. Oh, they will love to
Yeah.
tell you. There's another piece. Go
I
ahead
love that. I think that what you've brought out is really you need to engage with your kids, right? You need to engage with
and
your kids
listen.
around these things. You need to listen to them. You need to continually be monitoring and asking about these things and how they're impacting them, how they're using them. I think this is really one of those things where you have to be involved, right? You have to be involved more.
We can't rely on the creators or legislation. I want to, sorry to interrupt you, I want to add one other thing that I use and I suggest. Over the years, as my kids were growing up, it would happen once in a while that I would start to hear, and let's just use it for, just a basic example. One of my daughters, I'd start to hear a name of another girl a lot. And it wasn't in a bad way. Suddenly a name would pop up, or my daughter would adopt a behavior or start dressing in a way or add something. And I would say, oh, that's it. Oh, yeah. Madeline does this. Madeline says this. And it would happen all the time. But I would suddenly realize that there was some girl out there who, whether she was a queen bee, a wannabe, or a friend, or someone my daughter admired or was trying to align with, or in the friend group, I would hear a name a lot just by listening. Oh, trust me, in real life, my kid's mom and I, we need to find out about this Madeline. So we would have to have a play. Let's get this Madeline in here. And it was nothing ever bad, really. But I would start to hear that a real life girl was having some sort of impact or influence on my daughter's beliefs, behaviors, right? So I tell parents, same thing. If you start seeing, and it's not over a weekend or short, but a chronic change, and you start seeing that your child is changing in a way or has a belief system, or you start to hear a name or you start to see that something's different, I would strongly suggest, like we do if it's in a real life influence, find out. Also, if your kid is going into their room after school, and teenagers do that anyway, but you start hearing your kid talking to someone in the room and there's no one at your house, then I would also be paying attention to what are they doing? They're probably using one of these things.
Yeah, I think the key thing that I'm getting from this, Don, is it used to be know the people that influence your kids. Now it's know the people and the tools and the apps that are influencing your kids.
Just like we suggested with social media and social media groups and chats, the same as I've been telling parents, if you see a change in your kid and it's unfavorable, back it's with social media, or I'll tell you, it happened this year. I'm not going to lie. I'll disclose it. So my kids' holiday gift list for this year that we just had, I see what they would like for the holidays. Ernest, I was looking through this list, and a lot of these things I know they found from some influencer because I asked. And I'm looking at this and I'm like, okay, all these products, what is this? And then so my kids, even with commerce, they're, how they want the products they want are being influenced by digital sources. This is much more serious because what we have learned and what we have heard and what we're finding out is that these chatbots with the parasocial relationship, the anthropomorphizing of it, the sycophancy, all of these things, the availability, it is not a replacement for human therapists. There's a risks of incredible bias and misinformation being shared to a user. We have vulnerable populations. So if you already have a vulnerability, mental health struggle, these things are only going to exacerbate and amplify it. We don't know about data privacy because even though we erase it, no, they don't. These kids are disclosing everything to these chatbots. As clinicians and practitioners, we follow HIPAA laws. We have to be very, very careful with how we store information about our clients. These kids are bleeding out to these chatbots, and we don't know where that information is going.
There's no accountability. There's no accountability with the chatbots. Right. Don, this has been such a great conversation. There's so much more we could go into. How do people get a hold of you if they want to continue the conversation, or get ask you for some recommendations or suggestions, or contract your services? What's a good way of reaching you?
Well, okay. Well, I don't. It's you were the one who started all this, so if it's okay, there's two ways. They can always try to find me through you. Sorry, but you pulled me into this, so certainly you know how to find me. But if any of your listeners really want to find me and they have questions, they can email me. And my email is drdeej@gmail.com. It's spelled out, doctor. It's D-O-
And we'll have that on the show notes as well. So
Yes, but it's something we need to be vigilant about.
Yeah, I completely agree, Don. You've made such great points. I want to ask, what's your last parting advice or recommendation for parents and clinicians? What's your last parting recommendation for them?
I think it's what we said before. It's listen and pay attention. And especially for parents, don't try to lecture or teach your kids. Let them tell you, have them inform you. Because if you start sitting down and you start telling them, don't do this, this is dangerous, we already know what they're going to do. So I would suggest for parents, for clinicians, you need to, again, investigate. It's vital. Is your client engaging with these? And then you have to talk with them about what your expectations are about what they share and what they're telling the chatbot and what the chatbot's saying to them. You have to get that. And hopefully you can, if you're their practitioner or clinician or professional, you can hopefully have that alliance. They need to be transparent. With parents, I just think you need to be mindful. You need to pay attention. You also have to model behavior because a lot of adults are using these too. And so children will, and that's a whole other Oprah.
Yeah,
Kids are telling me when I'm warning them about it, they're saying, oh my God, my mom's chatbot is her best friend. I think she's in love with it. So
that's a great point. Absolutely great point. You need to model appropriate behavior. Yeah. And I can say, Don, as a parent, I absolutely agree. You have to listen to your kids because I can tell you listening is way better than trying to demand or tell them what to do because they don't listen, but they rather listen to the chatbot. So I absolutely agree with that. Don, I'll also disclose that as someone who loves AI and uses it all the time, I can fall into that trap as well as to when it just continues to reaffirm me and tell me that everything that I do is the best thing in the world. That sometimes I have to say, you need to stop affirming me. I am fine. You need to stop affirming me. Just respond.
Kids aren't going to do that. Kids are not going to tell.
No, they're not.
Anyone to stop affirming. But what you said right now, I just want to remind and maybe bookend with this. Let it be a tool. AI is not going anywhere. It's only going to become more sophisticated. No way, here come the robots. That's another show. So as it becomes more sophisticated, we have to just work with it. But one of the things we need to remember is they are tools. So for things like support, there's a lot of great things that we use and we can use AI for. But something like friendship, companionship, support, therapy, medical advice. No, these are not the things that we want to be using or leaning into AI for.
Yeah. And I think that's a great place to leave it there, Don. This has been such a great conversation, and I think we're just going to have you come back because we didn't even scratch the surface. I know there's a lot more we could get into. So, Don, thank you so much for coming on the show. Appreciate it.
Sorry, Ernest. It'll all be changed the next time around. We'll say, forget him because state of the art in the morning is obsolete by noon with this stuff. So I just predict, and I'm not saying this with that I'm happy, the next time around, it'll be, forget everything we said the last time.
Yeah, these are constantly changing. That's another thing about this. Don, thank you so much for coming on the show. I really appreciate it.
Thank you. Have a wonderful day.
Awesome. And if you have enjoyed the show, please subscribe and leave us a review. Feedback is a gift, and we love gifts. We hope you'll join us again.